Good afternoon. I am Dr. Sridhar. I am a senior neurosurgeon in the city of Chennai, India. I head the Institute of Neurosciences and Spinal Disorders at the MGM Healthcare Private Limited in Chennai. Hitherto, I was with Gleneagles Global Health City, also in Chennai. We run a team of neuroscientists and clinical neuroscientists who believe in integrated neurocare, where we look at patients as a whole and not at a specific entity of either neurology or neurosurgery or neurorehabilitation. Which brings me to what exactly is neuroscience. Neuroscience deals with all issues and what the brain actually is. The brain, the spinal cord, and the nerves. Now, the brain is actually an organ which is about 1.5 kilograms, located inside the head, which is a very thick skull, and that's how important it is because that's the most protected organ in the body. And that 1.5 kilogram of mass takes up about 20% of the blood volume of every heartbeat, because it takes about 1/5 of the total blood volume, because it requires that much blood and oxygen for it to work. So it's a high energy dependent organ which works, and this directs the work of every single organ in the body. Be it your heart, your intestines, be it your lungs, your liver, your breathing, your moving about, your thinking, whatever you do and whatever your body does is ultimately directed by the brain, the spinal cord, and the nerves. The remarkable thing is that the brain's activity, we don't really know too much about it. There's still a lot we don't know about it. The brain's activity is such that it is an electrical activity in millivolts. And how these millivolts communicate with each other is by chemical energy. So these millivolts are transformed into small molecules of chemicals, which then transmit this information, which has to go across, and then this again becomes millivolts, and that's how this energy travels, just like how the energy travels from, say, where the energy source of the electricity is to the substation, and then to your transformer, and then into your house. So similarly, from the brain, all these impulses go down to your nerves, through your spinal cord, and then finally to the tips of your fingers and to different parts of your body. And that is what the nervous system is about, and that's what we do. To make the nervous system better, to identify what the problems with the nervous system are, and to see how we can get it back into functioning as normal as possible.
Alright, doctor. So the first question is, what are the common nervous problems that people are facing right now? So you'll be getting a lot of queries as to, general questions that you might be getting. So what are the common complaints that you see?
The most common complaint that we face is headache. George Bernard Shaw once said that headache is something which a person would definitely experience at some point of time in their life, and it's so true. Everybody has a headache, and the point is, the headache is indicative of a strain, of a pain in the head, and this can be due to so many things. It does not mean that a headache means a problem with your brain. It can mean that you have a bad tooth. It can mean that you have a common cold. You have sinusitis. You can have even anemia, which is so common in our country, can lead to a chronic headache. But there are certain red flags when it comes to headache that you must look out for and go for specialist treatment. For example, if you have a sudden severe headache which you've never experienced before, or the character of your headache changes. Now, these are all red flags which you have to seek the attention of a specialist. Or if you have a chronic headache which is not going away with medication, which is the normal general medication, then it's better you seek the attention of a specialist. So headache is one of the most common things. And one of the most common causes of headache nowadays is tension and stress. Everybody has targets, everybody has to achieve something. You need to achieve, and you always feel as though you're not achieving it. Your bosses put pressures on you, and that leads to so much stress and tension in today's world, that headache is something which it transforms into, and that is something which is so important to recognize.
Alright, sir. So we've got a question from Mr. Satrapan. Good morning, doctor. I have been having constant back pain for some time. Could it be related to any issue with the spine?
Back pain is always related to a spinal problem. The pain in the back is most often because there's a strain on the muscles of the back. Now the spine, if you look at it, is not just a column of the vertebral bodies which it's made up of. It has inside it a very important thing, which is the spinal cord, which transmits all the nerves. Now this is supported by muscles. It's like a flagpole where you have the flagpole, and then you have the ropes which hold the flagpole erect. And all these are important. So coming back to your question, back pain is indicative of some problem in your back, which may be because of the bony spine, which may be because of the nerves, or maybe because of the muscles attached to the spine which hold everything in place. So back pain is related to your spine, but the cause of the back pain can be varied.
Alright, sir. And there's one more question from Suresh. I can feel tingling sensations in my hands if I use them in the same position for some time. What could be the reason?
This is very common, especially with today's world, where you have a laptop in front of you and then you rest your hands in one position and go on typing in that. The problem is that once you have your position in one position for a long time, sometimes that position is not ideal for either your nerves or your blood vessels, taking blood to the fingers and to your arms. Just like when you sit down on the floor, after some time you might get pins and needles in your legs. Similarly, even in your arms, if your position is not correct, when you're either typing on your laptop or on your desktop or something like that, you may get pins and needles. The best thing to do is every 10 minutes, try and move your arms about, just 2 freehand movements, and you'll see that it's becoming better. If it does not become better, it continues despite this, then you have to see a specialist.
Could it be a symptom of any nervous problem, the pins and needles that you told us?
Pins and needles are because of the nerves. Ultimately, anything that you feel is because of the nerves. But the thing is, why is it happening? It can be such a simple thing that you have rested your arm in such a way that you are getting it. So all that you have to do is change the way you rest your arm on your table. Or it can be something more serious, where you would have to seek out the opinion of a specialist, get investigated, and have an appropriate treatment. So it depends on what it is, and if you're worried about it, see a specialist and get rid of your worries.
Alright, so there's one more question. Vertigo is a major problem that people see now. Is it curable, and why is it occurring?
The major cause of vertigo, which in Tamil you say talasuttal, in Hindi you say chakkar, maybe is when you feel that everything is going around you. And that is most often because of the improper working of the two balance mechanisms that we have inside our head. There are two sets of these, one on either side, and there are 3 nerves which go to the brain, which carry these impulses of where you are in space every fraction of a millisecond. It's a continuous information. So 6 nerves have to come simultaneously feeding that information, and the brain incorporates and says, yes, I'm standing straight. Okay, I'm tilting my head. Now, even if one of those nerves is delayed in its impulses by a fraction of a millisecond, you feel that you're going around because the brain doesn't understand. That is what vertigo is. Now, is it curable? It is generally happens because of either a swelling of the nerves or an infection of the nerves or just weakness of the nerves. So you would have to take medication just for the passing phase, and then get rid of it. But anyone can get vertigo at any point of time, especially when you're feeling weak, when you have a fever and things like that. You're more prone to get it. But yes, can take medicines and you can become all right. That's nothing to worry about. But remember, vertigo can also be the signal that there is something more wrong, where if it does not go away with medicines, then you would have to take a scan and find out the reason. There is a myth that vertigo is caused by cervical spondylosis. This is wrong. Vertigo is not caused by cervical spondylosis. It cannot be caused by a neck pain. This is a wrong fact. People thought it used to happen, but now it is proved that it cannot happen, and therefore it is not the reason.
Alright, sir. Snehal asks, I have shooting pain in my neck and shoulder. Could it be a nerve-related problem?
Like I said again, anything that you feel related to pain, tingling, sensation, everything is related to the nerve. The question is, why did you get it? Most often, pain in the neck and coming to the shoulder is improper posture associated with anxiety and tension. Again, laptops, desktops, often placed improperly on the table. The height at which you are sitting and the height at which the laptop screen is different, and therefore you would have to bend your neck like this, and sometimes you're so into your work that you don't realize that you're doing this for a long time. And therefore the muscles get weak and they get tired, and therefore you start getting the pain. That's the most common cause, and that is because the nerves in your muscles start saying, look after me, something is not right. So yes, it is because of the nerves, but look at the way you're sitting at a table, looking at a desktop screen, and that's the most common cause of neck pain.
Praneet is asking, I have continuous headaches. I don't get migraine headaches. I've also got my vision checked. What could be the reason for these headaches?
There are multiple causes of headaches. The most common cause of headache is anxiety and tension. If you are okay, you don't have anxieties and tensions, and you're not a very stressed out person, and you're still getting constant headaches, then I suggest you consult a specialist, because there are multiple causes of headaches. And there is no one fixed medicine. Depending on the type of headache, you need to take the specific medication. Therefore, it's better you consult a physician, a specialist who can give you the right medication.
Alright, sir. So here is a question related to postures. Which is the right position to sleep in at nights to avoid neck or back pain in the morning?
Your body will tell you which is the best position. There is nothing to say that you should sleep only in one particular position. Our psychology actually determines the position we sleep in. You may say, yes, I'm going to sleep straight up, looking at the ceiling. But once you fall asleep, you automatically turn into the position that you and your body are comfortable in. And that is what you will find yourself in when you wake up. The common cause of back and neck pain when you wake up is because of wrong sized pillows and wrong mattresses. You must use a mattress that is firm. It can either be a cotton mattress or a coir mattress, but nothing which is very soft and where you just go into. Because these mattresses which are very soft and you just envelops you, the problem that happens is that there is no firmness to support your body, and that's why in the mornings you develop back pain. Similarly with pillows, if you have a pillow which is very big or very small or sometimes no pillow, then you develop neck pain because your neck needs the support it needs. Therefore, listen to your body, but have a firm mattress and a cotton pillow. The cotton pillows are the best. You can also have other pillows, but something which you feel is comfortable for you. So each pillow is different for each person. If you're having neck pain when you wake up in the morning, change your pillow.
So here is a surgery focused question. One of my friend had an LSCS surgery. In the future, will she face any spinal cord problems?
She should not. if she had had an LSCS surgery, that's really got nothing to do with the back problem, except unless she has had a spinal anesthesia given. Spinal anesthesia is given every day to thousands of people who undergo different types of surgeries, and the risk of having a spine problem because of that is very, very small. And I don't think that you should have that in your mind, because the more you think about it, the more you'll have back pain. So don't think about it. I don't think that's going to be a cause for back pain or any other problem in the future.
Alright, sir. And generally, when people come to you for consulting regarding surgeries in the spine or in the brain, or the lower part of the neck and all that, so what are the fears that they face, and how do you think those are true or not true?
The most common advice people give in society is health advice. So when people are told that they require a surgery, of course they are worried, they are anxious. Nobody likes to undergo any surgery or cut in the body. But the point is, don't listen to the next door neighbor for medical advice. Worse still, don't go to the internet for medical advice. There is a whole lot of untruth there, just like about everything else. It's just what people put up. That's what you find. They are not specialist opinions meant for you. The most common fear people have when they come for spine surgery is the question they ask: will I get paralyzed? Now, why is that fear? Because somebody has told them they will get paralyzed, or somebody has told them my relative's best friend's relative got paralyzed. There is no answer for that except to say that in current days surgery and the way we investigate patients before surgery, number one, we are very sure that the surgery is going to be safe. Number two, the type of technology used in surgery nowadays and the monitoring, that is how we look after your blood pressure, everything during the surgery, is so safe that the risk in even very, very difficult surgeries is less than 2%, which is actually less than if you would have to travel on any of the highways you would today, or take a flight to anywhere. You don't ask the pilot, will I crash? What is the percentage of my crashing? So it is, yes, there is a risk. There is nothing without risk. There are no guarantees, because this is a science. It's not a given. Even in material goods, there are terms and conditions for guarantees. So there is no guarantee. There is a risk, yes, but the risk is very small. What you have to look at when you need to go for a surgery is to look at the benefit versus problems, the ratio, and which is better. Is this surgery going to help you, or is it not going to help you? So if the risk of doing surgery is much more than the risk of not doing surgery, then you should not have the surgery. But if the benefit of surgery is much more than the risk of surgery, then you would have to have the surgery. Most often when we advise surgery, it's because the patient has done everything else, especially for back and spine surgery. Is patient has done everything else, and then the patient is still in severe pain, and the MRI scan shows that the patient has a problem, which explains what the patient has. Then you say, yes, you've done everything, and I think this will give you relief. And with the current risks in surgery of less than 1 to 2%, I think if there is definite benefit which is going to come from surgery, you're definitely going to have a good relief. So you shouldn't worry about it. Don't listen to non-specialists. Even don't listen to general medical doctors, because they don't know very highly specialized surgeries. Like if you ask me about a highly specialized cardiac surgery, I won't be able to give you the details. Yes, I know, yes, this can be done, but I can't give you details. So similarly, go to a specialist of what you want to do in. Listen to them, ask your questions, but don't ask the internet or your next door neighbor.
Alright, sir. And post a spinal cord surgery or a spine surgery, will the life of an individual be restricted, as in these are the activities that he can do? Will it be confined within a very small world? How is it post surgery for an individual?
If a patient has a spine problem, the patient already is restricted in their activity. Post-surgery, the aim of doing the surgery is to get them back to normal life as much as possible. My philosophy is that the reason we are doing the surgery is to allow the patient to get back to their normal life. So I don't even advise bed rest. No bed rest. No rest for anyone. I don't give myself rest. I don't give anybody who works with me rest, and I don't give my patients rest. They are out of bed the next day. Yeah? Yes, there are certain things you should not do for the first couple of months, and a little longer for certain complex surgeries, but there is nothing which does not allow you to live a reasonably full life. For example, if you are having a disc surgery, you can start walking about, you can go to work within 10 days or even within a week. You can start working from home if you want. You can cook, you can do things like that. But don't say, no, I want to go to the gym and lift 50 kgs or 25 kgs. That's not allowed. Don't try jumping, because that's not good, because it will jar the back. Basically, it is common sense. Same way, in Chennai, I say don't ride a bike, because if the road is bad, you'll be jarring your spine. And you want that to heal before you ride a bike. So the thing is, you've had surgery on a particular part of your body. Look after that part of the body, but don't not do things. You can go to the theaters, you can go see a film, you can go shopping, you can go to a wedding, you can do everything. You can go to work, most important. Yeah? You can do all that. So there is no narrow world that you have to live in. It's a wide world with a very narrow restrictions that you should not do. And remember, you have to do also exercises to strengthen your back after back surgery. It is very, very important, so that you look after your problem area. You're having a surgery because you have a problem. So look after that problem, and then you'll be fine and you can live a full life. There is no restriction for general life.
Right. And are there any specific problems that you have to take care of a spine? As in, the question is, what are the common problems which you've already answered, the pain and all that? How should we take care of it? Are there any specific issues these days that we have to face?
Yes. For example, the most common cause of back pain, neck pain, and upper shoulder pain is because of how people sit through the day. When you sit, especially a lot of youngsters work on laptops. I mean, almost everybody works on laptops and desktop. Even I do. You need to have your chair in such a way that you have a good back support. You should not sit at the edge of your chair and lean forward. You should not, do that. And if you have a desktop or a laptop, you should not be looking at the screen like that through the day. That will definitely give you back pain and neck pain. Your back should be supported by your chair. Pull your chair under your table so that you don't lean forward, but you are rested in the back like that, and you pull your chair forwards, and you should have your screen at eye level. If you have a laptop and your table is not good enough, talk to your HR so that you get a chair which can go down, or put some books underneath and lift it up. Yeah, simple solutions which will cure you of your back pain. Second thing, sitting in one position for a long time is not good. Same way when I spoke about pins and needles in the hands also, it's not good. So once in an hour or so, get up, just take a 2-minute walkabout, say hi to your friend in the next cubicle, in the next room. That will make you friends. Plus, it will give you some exercise. They see that in the flights as well. that you don't be sitting in transcontinental flights. You have to walk about so that there is some circulation to your body. You move your arms and legs about. That's good for you. So these are basic things what you should do during the day. Number 3 is exercise. I have people coming to me saying, oh, we work from morning to night. There is no time for exercise for myself. But my point is, unless you look after your own body, you're not going to be able to work for your employer better. You're going to develop problems which are going to be health-driven problems. So make sure you do some sort of exercise, physical activity exercises, at least for half an hour a day. Whatever you feel like doing, there are a lot of ways you can do that, and you should do that so that you give that to yourself. And I think that's a very good way of maintaining your own health. When you lie down, again, I've spoken about a firm bed, a firm mattress. It doesn't have to be on the floor. A firm mattress is good, and a pillow which suits you. So these are small things, common sense things, very easy, which can help prevent back pains.
Alright, sir. And another question is also...
And sorry, one more thing. If you are riding a bike, wear a helmet. That will not cause neck pain. Number 2, ride slowly on bad roads.
Alright, sir. Thank you for these tips. There is one more question related to back pain, but this is lower back pain. I have constant lower back pain. Could it be a problem of the spine?
It is a problem with the spine. And if you have a constant back pain, you need to get it checked out by a specialist.
Alright, sir. And one more general question. So these days we all have smartphones with us. Even while we're sleeping, we keep it near our head and sleep. Will it cause any damage to the brain? I mean, there are so many rumors flying around regarding that. So can you just...
Rumors are rumors. So you must take it only as a rumor. So, but having a phone next to you when you sleep, next to your head when you sleep, that's going a little excessive on usage of cell phones, and I don't think anything excessive is good. Yeah, usage of cell phones is very good, but don't keep it next to your head when you sleep. That's a bit going too far. Now, will cell phone usage damage your brain? Cell phones do work on radio waves, but there is no proved evidence that it does damage you. I think the damage is more psychological because you become dependent on it. When you have nothing to do, all that you look at is your old images. Is there anything for me on my this app? Is there anything for me on my that app? And I see people going on looking at old images, old messages. There is nothing new. Shut it down. Yeah. So it is more of a psychological dependence which starts off when wanting to be more on in the space rather than actual damage caused by the cell phone usage itself. It is, I think, more of a psychological dependence which starts off rather than anything else.
Alright, sir. And there's one more question based on what you've discussed. So we've discussed about the pillows that we have to use. A person is asked, is sleeping without pillows advisable?
No, it's not advisable. It's not advisable. See, everybody, you have a head, you have a neck, and then you have your shoulders and chest. What happens to this space? Your head is bigger than your neck. Your neck is a small cylinder like this, and then you have a big round head on top. Now this has to be supported. How do you support that? If you do that, then your neck will dangle like this, and then you'll definitely have neck pain in the next morning. Yeah? So you should have a pillow. The size of the pillow, actually, I said, is individual for each person. That's because each individual person's neck is different. So you have to decide whether you want a large pillow, short pillow, what sort of pillow you want, how soft it should be, how firm it should be. Our ancestors used wooden blocks as pillows. Many people slept with those as pillows, but always have something to rest your head and support your neck.
Alright, sir. And there's one more question, which is when I sleep at nights and get up in the morning, I feel tingling sensation in my feet. So these pins and needles that we're talking about, only after getting up in the morning, just sleeping and getting up in the morning. What is the reason for that?
There are multiple reasons for that, and very often it is because perhaps your feet are tucked up in under your cover, and you have not moved your toes about, or maybe the air conditioning is very cold. It can also be seen in diabetics and in some other medical problems where you see in people with thyroid issues. So all these are conditions where you can see this. If it's a constant thing and it's not a one-off thing, I think you should consult a specialist.
All right, sir. So, any words that you'd like to say to the audience that are viewing right now?
90% of what society perceives as a neurological problem is actually a very common sense issue, something which has not been done right, and therefore you are experiencing an issue, and has very common sense answers and remedies. It's only 10% which are serious. Now, when a specialist tells you that you have a serious problem and you require a remedy for it, my suggestion would be that you listen to your specialist instead of listening to the internet or your neighbor. Modern day medicines, surgeries are much better than what it was even a decade ago. And therefore, the risks of having the medication or the risks of having the surgery are much less, and will no doubt do you good. One more thing is that the brain is such a fantastic organ that most of us use a minuscule part of it. And we think that we are losing memory, but we are not actually. It's only that we are not paying attention. The more we use our memory, the more we use our brain, actually use our brain, the less we will have problems like dementia and other issues when we grow older. So my last message perhaps to everybody is, try to spend at least half an hour a day using your brain. We do everything subconsciously. Walking, driving, eating is all subconscious. Our mind is somewhere else. But we should spend at least half an hour to 1 hour a day doing something, thinking and using our brain. And that would be very good for us in the long term.
Yes, sir. Thank you very much for sharing valuable inputs to us.
Thank you so much. Thank you. It was lovely.